Okay, this video is called Low Testosterone and Brain MRI. So when a patient goes to a doctor, the doctor has a checklist of things that they're obligated to do. So if a patient has a low testosterone, most of the time it's because of their diet and their behavior, or sometimes it's other things like they've got an infection, orchitis, infection in the testicle, they've had previous infection with scarring in the testicle, they could have HIV. Those are obvious causes, but a lot of times it's because they got their cell phone in the front pocket. Lots of guys carry their cell phone in the front pocket, incredibly stupid. They sit with their laptop on their lap all the time. They're low power microwave transmitters. Excessive psychological stress, they're going through a difficult time, sleep deprivation. What I'm trying to say is you want to check for all of these things, first of all, on your own. Look up the causes of low testosterone. See which ones you can obviously rule out in your own life. And if you're still having a problem and you can't fix it on your own, obviously, go to the doctor and see if they can help you. But what I'm trying to say is what I often see is patients go see a doctor and then the doctor it's because it's on their checklist. What could this be? A pituitary brain tumor, and they get a brain MRI. I can tell you, if the patient has isolated low testosterone with no other findings, like if they've got very high prolactin, like more than double the level of prolactin that a normal person would have, then they might certainly have a prolactinoma, macroadenoma, prolactinoma of their brain. But that's rare. If you just have an isolated low testosterone, what I'm trying to say is there's a high chance you're going to end up getting a brain MRI you don't need if you go in there and you haven't ruled out all the other stuff first. So I can tell you, I have talked to my colleague neuroradiologist, and four of us, okay, with a lot of experience. Between the four of us, we've got 100 years of experience. And with isolated low testosterone, not a single one of us has ever seen anything that we think is a useful finding on a pituitary MRI. We often find what we would consider maybe normal variants. You can get little cysts in the pituitary. We don't know if they're non-functional microadenomas. Maybe they are some type of other microadenoma that's mildly functional, but they're probably not important clinically. So what I'm trying to say is, once you go here, I'll show you some pictures. Once you go and you start, the ball rolling. This, by the way, is a study on pituitary MRI and hypogonadism. Low testosterone is called hypogonadism in a male hypogonadism. If you got more than double the amount of normal prolactin, you might have a prolactinoma. But that's a different situation. That's when you have a known, obvious, other than testosterone hormonal problem. What I see tons and tons of patients get caught up in is, I call it the Hotel California syndrome, where they get an initial set of imaging and there's no definitive major finding, but there's a little maybe this, maybe that, and they get stuck going for follow-ups. And all the doctors, the radiologist is going to see thousands of these patients, so they always have to follow them, because if it's even just one out of a couple hundred, that ends up being significant. But for you yourself, if your odds are 99.5, 99.9, you don't want to follow that, because you get stuck in all these follow-ups. A lot of times it's better not to know. I'm just trying to protect you. I see all this stuff, and I see lots of patients stuck in these things. Maybe your insurance pays for the first one. Is your insurance going to pay for all the follow-up CAT scans, follow-up MRIs that you didn't even need in the first place? So don't get me wrong. There are special situations where it is good to obtain the imaging. But most of the time, you're far better off going through all the common causes first, trying to fix those on your own, and then this is an elective problem. This is not an emergency problem. And if you can't square it away, then go ahead and get all this imaging. But lots of patients end up getting one of these and they end up going for follow-up MRIs, potentially for a couple years, getting IV contrast injected, the gadolinium, when that could potentially be avoided. Get all the aluminum out of your water, the F- out of your water, manage your stress, don't put your phone in your front pocket. See if it's a medication side effect. Don't be drinking alcohol. Manage your diabetes, etc. All of these things, your hemochromatosis, if that's it, before you get stuck in Hotel California, multiple follow-ups. Hope that's helpful.